Hey guys, Zach here. Gonna do the cranial nerve tests. The first one is olfactory cranial nerve 1, which we're gonna test the smell. So we'd have the patient right here, close their eyes and have them identify the substance under their nose. They'll also close one nostril, so then I would hold the coffee underneath the nostril and see if they can tell me what the scent is. I'd have them, yikes. Then I would have them close the other nostril, and I would put spearmint or something else with the potent smell underneath the other one and see if they can get that as well. The next one is going to be the optic nerve, and that's cranial nerve 2, and we're going to test vision. We'll have them close an eye and have them read off a lettered chart. So I would put the phone up with the chart on that's got the numbers and stuff and have them read down as far as they can. And that's going to test their vision. Then we'll test periphery, and I'll ask when my finger becomes visible. So I'll be out here and move it in and have them tell me when, like they would say now, and you come now. And I just go back and forth and test each eye while they cover one eye. The next test, I would also take a flashlight and shine it into each of their pupils back and forth and see the dilation between the two and make sure they're on the same page. The next test is, this is actually for cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens, and this is motility. We'll have the patient hold their head still, and then I'll tell them to follow the fingers side to side and up and down. So this is just testing those muscles back and forth and just making sure that that's going fine, and then up and down as well. And it says you could do like a rectangle and stuff like that just to make sure the muscles of the eye are working correctly. The next test, trigeminal, I would have a Q-tip. I guess this could be my Q-tip, my pen. And then I would just touch the 3 different parts, 1, 2, and 3 of the face, and then so I'd touch them both bilaterally. So I'd touch up here, have them tell me where I touched, come over here, tell them where I touched, and try to do it with the same kind of strength, and then they'll say if they can feel it weaker, not as weak, and stuff like that. So just back and forth, like that, and yep, that'd be good for that test. And then for cranial nerve 11, we'll do spinal accessory. These are testing the traps. So I would put my hands on the trapezius and have them try to resist against shrugging, push them down, and just kind of make sure there's strength there. And then I would also test the sternocleidomastoid by holding the head of the patient and then having them try to turn against me, and you'd obviously do that bilaterally just to make sure that those muscles are working properly as well. The last test is cranial nerve 12, hypoglossal, and I'll have them stick their tongue out, and we would just look for any tongue deviation. Also, what you could do is have them put the tongue and push out on each side into each cheek and just make sure there's good strength on both of those. So that's the cranial nerve test.